I spent months digging into Medicaid fraud, and I thought I knew what corruption looked like. Then a witness sat before the United States Congress and said, 100% of the companies he investigated were run by Somali, Bhutanese, or African immigrants. Not a majority, not most of them, every single one. And the congressman running that hearing didn't push back. He didn't ask for the methodology. He turned to a Democratic state senator and asked, "Has Somali immigration been good for Ohio?" That's not oversight. That's a hearing being used as a weapon. And what happened next will show you exactly how.
Now recognize myself for 5 minutes for the purpose of asking questions. Mr. Rosiak and all the witnesses, thank y'all again for coming here. Mr. Rosiak, you've identified multiple individuals and LLCs that you believe engaged in fraud. How many of these had Somali or Bhutanese or other African origin names?
100%.
100%. And how many did you look through? I mean, that's 100% of how many, roughly?
I looked at the names of hundreds of companies. I looked more deeply into maybe 50.
More deeply into 50, you looked into hundreds of companies, and 100%, you're telling me, had names that were Somali, Bhutanese, or other sort of African origin derivation.
Correct. I thought I saw an American, and I was very excited, but it turned out to be the teenage son of that money launderer, who was actually just a proxy for this woman from Ghana.
What are some of these names that you come across? Do you hear the same names, or are they different names?
Yeah, it's funny because this started off, I was investigating a guy named Robert Achiapong, and then I found a different scammer named Roberta Achiapong, and I thought they were related, but they weren't. It's just, that's how common it is to scam Medicaid when your name is Achiapong. And then I did the same thing with a guy named Aliu Conte, who has 30 criminal charges in Cuyahoga County, or in Franklin County, and threatened my family, malicious wounding, crazy stuff. This guy's a career criminal. And then there was a different guy named Alfred Conte, who was convicted of Medicaid fraud, but Ohio, Franklin County expunged his record. They let him plead down, and then they expunged his record. He didn't have to pay any money back except like $500, and the Ohio Nursing Board let him keep his license. So you've got the Contes, the Achiapongs, and it just seems to be the family business is billing Medicaid.
Criminal rings. We did a lot of work previously this year on Medicaid fraud in Minnesota. There seem to be a lot of similarities here. Can you tell us in your investigation, have you found any connections between Ohio Medicaid fraud and the Somali fraud that we saw in Minnesota?
Yeah, it's the same people. They all have relatives in both places, and they move back and forth. First of all, I think there was $130 million in cash that transferred from the Columbus airport to the Minnesota airport and then to Somalia. And so they're moving basically briefcases of cash. And the same, there's one guy that had, basically he racked up $30,000 in tax debts in Columbus running this daycare center and not paying his taxes. So then he started a home health care company in Minnesota, billed $35,000 in 1 month, and then dissolved the company.
So I just want to be clear, your testimony is that there is a large interstate criminal enterprise of Somali fraudsters that are defrauding the federal government in multiple states of potentially billions of dollars. Is that your testimony?
Correct.
And can you give us a sense of the scale of this fraud? We saw it in Minnesota, we're seeing it here, but have you seen it in other places, or can you give us a sense for either dollar values or the number of people involved, in your opinion?
There's thousands of people involved. I would say the majority of Bhutanese people are either on Medicaid home health care or are providing Medicaid home health care services. They had recently 15,000 people. This nonprofit group, this advocacy group, which is tied to actually founded by a home health care guy. They had 15,000 Bhutanese people come to this party in Ohio, and they'd bust in all the participants on their Medicaid vans because everybody there has their own Medicaid company. And so I think Bhutanese people are systematically using Medicaid, not only in Ohio, but also in Pennsylvania and Kentucky and New York and in other states where they perceive that they will pay the family member and they will pay for non-nursing services, and those are the two big vulnerabilities.
So it's not just the Somalis, it's also Bhutanese, it's across multiple states. They're coordinating with each other. There's a network of foreigners running criminal fraud rings within our government, within our country, I should say, defrauding our federal government. thank you so much for the work that you have done on this. It's been fantastic reporting, so we really appreciate this. Senator Antonio, thank you for being here. Has Somali immigration been good for Ohio?
You know, that's really outside of my purview of
You're a state senator. Would you like to see more immigration from Somalia?
As far as I'm processing your question, and I have to say that I was almost brought to tears just now.
72%
because
of Somali immigrants are on
the rate
welfare.
and the level of hateful rhetoric based
You're
on
defrauding your
false
state at an
information
astounding rate, and I think that most Ohioans
is
would have a
shocking
problem
to me.
with that.
The lack of even humanity to
I
group
think it's
a group of
inhumane to allow
people
your own
together.
state to be defrauded
I am
at
shocked.
astounding
I
rates.
am shocked
Billions
and
of dollars
appalled by the
taken out of the
behavior
pockets
there
of
right
working
now.
class people,
I am
going to
shocked.
criminal fraudsters.
Because
I certainly have a major problem
in every
with that.
community,
I think
there are
that's an
good
issue, and I think
people
most
and there are
Americans
bad
agree.
people.
Chair, regular
There are
order.
But to
good
try
people
to
Understand we're not
say
supposed to
bad
disrespect.
people.
We're not supposed to
And
disrespect
with
our
that
witnesses.
said, we're out
member
of
of
time,
a
Ms.
group
Antonio.
We're not
is
supposed to
somehow
disrespect
a
our
We've already gone
criminal
over here.
is shocking to me. I am shocked and
We're
appalled.
already out of time here. That said, thank you to the witnesses for taking the time to come here. It's always fun on the Oversight Committee, always exciting. In closing, I want to formally thank you guys for your testimony today. With that and without objection, all members have 5 legislative days within which to submit materials and additional written questions for the witnesses, which will be forwarded to the witnesses. If there's no further business, without objection, the task.
Let me just validate the feeling you probably had while watching that. Because what you just saw was not a Medicaid fraud hearing. I know that's what it said on the agenda. I know that's what the witnesses were called in for. But somewhere between the opening questions and the closing gavel, this stopped being about stolen federal dollars and became something else entirely. It became a demonstration of how you hold a hearing about immigration while pretending to hold a hearing about fraud. And once you see the mechanics of how that works, you cannot unsee them. Let's start with what Medicaid fraud actually is, because the real problem deserves to be taken seriously before we talk about how it got hijacked in that room. The federal government loses somewhere between $60 and $100 billion every year to fraudulent Medicaid billing. The False Claims Act, the primary federal statute used to prosecute this, allows both the government and private citizens to bring cases against fraudulent billers. Inspector General offices across the country have documented fraud rings in home health care, in daycare billing, in durable medical equipment. The prosecutions are real, the convictions are real, the criminal networks are real. None of that is specific to any single ethnic or national origin group. That sentence is the one that matters most for what you just watched. Luke Rosiak came into that hearing room as the star witness. He said he looked at hundreds of companies and investigated around 50 of them more deeply. And then he said, without a single pause, without a single qualification, that 100% of the fraudsters he found had Somali, Bhutanese, or other African origin names. 100%. 50 companies. Multiple states. I want you to think about what it would actually take for that number to be statistically true. It would mean that in the entire state of Ohio, across every Medicaid billing entity, every home healthcare provider, not one white American, not one person without an African origin name has ever committed Medicaid fraud. It would mean that one of the most commonly prosecuted white-collar crimes in this country is somehow committed exclusively by one demographic group. That is not a finding. That is a selection bias dressed up as a finding. Confirmation bias describes what happens when you begin an investigation already knowing the answer you expect to find and collect only the evidence that confirms it. When your methodology starts with names, when you filter first by what a name sounds like and investigate second, you find exactly what you went looking for. That's not journalism, that's targeting. And here is what should alarm you. Not a single member of that committee asked Rosiak one methodological question. Not one person asked how he selected those 50 companies. Not one person asked what percentage of total Ohio Medicaid providers they represented. Not one person asked whether he had any control data at all, because that wasn't the point of having him there. The point became clear about 4 minutes later. After Rosiak finished describing what he called a massive interstate criminal enterprise, billions of dollars, briefcases of cash moving from Columbus to Minneapolis to Mogadishu, Brandon Gill turned away from him entirely. He turned to Nickie, a Democratic state senator from Ohio who had come to this hearing representing her constituents, and he asked her, "Has Somali immigration been good for Ohio?" Sit with that question for a moment. Not, "Senator, what oversight mechanisms does Ohio have for Medicaid fraud?" Not, "What legislative fixes would you propose?" Just, "Has Somali immigration been good for Ohio?" That question has a name in political communication. It's called a loaded pivot. You use a loaded pivot when you want to move from a factual record to a value judgment about an entire group of people, while making the transition look like a natural continuation of the same conversation. Gill spent the first part of the hearing letting Rosiak build the scaffold: fraud, billions, Somali names, criminal enterprise. Then he used that scaffold to justify the question he actually wanted to ask all along. The trap had two exits, and only one was safe for him. If Antonio said yes, Gill could clip that as a Democrat defending a community he'd just spent 20 minutes associating with organized crime. If she stumbled, he could clip that as a Democrat with no answer. What happened was the third option he didn't plan for. Antonio said she was brought nearly to tears. She cited research showing immigrants commit crimes at significantly lower rates than native-born citizens, accurate, and replicated in peer-reviewed criminological research for decades. Then Gill cut her off, called working-class fraud victims the real humanitarian crisis, and closed the hearing. He got the clip. The segment ends with him looking righteous. She looks emotional. Rosiak's unchallenged testimony sits in the congressional record as though it were established fact. This is a three-step maneuver, and it has been used before. Step 1. Bring in a witness who produces dramatic numbers attached to a specific demographic group and let those numbers go completely unchallenged. Step 2. Allow enough time for those numbers to build an association between a racial category and criminality in the audience's mind. Step 3. Pivot to an immigration question, knowing the witness's framing has already preloaded the answer. What you just watched is not how you investigate fraud. It is how you launder an immigration argument through a fraud hearing. The real Medicaid fraud problem does not get solved by a hearing like this. It gets obscured by it. The actual mechanisms that allow fraud to persist are specific and fixable. Inadequate real-time billing audits, inspector general offices that are chronically understaffed, state agencies that lack the infrastructure to cross-reference providers operating across multiple states. None of that was discussed. Not 1 minute of that hearing went to how you actually close the vulnerability. Because closing the vulnerability doesn't generate a clip. And there is a human cost to that failure that never makes the highlight reel. The Bhutanese and Somali home healthcare workers in Ohio doing legitimate work now exist in a public record that associates their entire community with organized crime, based on methodology that nobody challenged. The families who depend on Medicaid home healthcare now face a political environment in which their caregivers are treated as presumptive criminals. The inspector general investigators who actually prosecute this fraud, regardless of who commits it, their work gets collapsed into a racial narrative that makes their job harder, not easier. Fraud hurts real people. Bad oversight hurts real people too. The difference is that only one of those makes a congressman look powerful on camera. I have spent enough time studying how oversight hearings work to recognize the tell. The tell is the moment a congressman stops asking questions that could produce policy change and starts asking questions that could produce a clip. Governance asks, what is the mechanism of this fraud and how do we close it? Performance asks, has this immigration been good for your state? One of those questions leads somewhere. The other one is a destination in itself. Nickie left that room shaken. And I think what shook her, what should shake all of us, is how fast it happened. How a hearing about federal dollars became a referendum on whether an entire community belongs here. How testimony with no methodological foundation entered the congressional record as settled fact. How the only person in that room who pushed back was the one who had been set up as the target. Democracy doesn't collapse in one dramatic moment. It erodes hearing by hearing, statistic by statistic, pivot by pivot. And the only thing that slows that erosion is enough people watching closely enough to notice when the question changes. If this helped you see something you wouldn't have seen otherwise, share it. Subscribe, because the next hearing is already scheduled, and this is exactly the kind of moment that reshapes how power works in America when nobody's paying attention.